Welcome back. Today's topic is vascular dementia and the fifth part of the six-part dementia series. Rather than covering all types of dementia in one video, I have divided this into 6 individual parts so you can watch the one you are interested in. What is vascular dementia? Vascular dementia is caused by problems in the blood supply to the brain due to damaged or diseased blood vessels. A stroke or mini stroke, also called transient ischemic attacks. This deprives the brain cells of the oxygen and nutrients they need to function effectively, which may cause problems with concentration, thinking, and carrying out everyday activities. If these problems get progressively worse, the person may be diagnosed with vascular dementia. If you are interested to know more about stroke, you can watch my video on this topic. The link is in the description. Let's look at its symptoms. The symptoms of vascular dementia depend on which area of the brain is affected, but in general, these are concentration problems, poor short-term memory, difficulty with everyday skills, slowed thought processes. Then there may also be changes in behavior, personality, ability to solve problems, ability to make decisions and plans, organizational skills, mood, particularly rapidly changing mood. If someone develops symptoms of dementia after a stroke, they may also have speech or vision problems. Then there is another type of dementia called Wenger disease, which is also known as subcortical vascular dementia. In Wenger's disease, the damage is the result of the thickening and narrowing of arteries that feed the subcortical area of the brain. The symptoms include early loss of bladder control, speech problems, movement changes, personality and mood changes, increased risk of falls, reduced facial expressions. About 10% of people with dementia have mixed dementia. This is a combination of 2 or more types of dementia, usually Alzheimer's disease and vascular dementia, and the person may have symptoms of both. People with vascular dementia may have periods where the symptoms seem stable, but they will always worsen over time. So who is at risk of vascular dementia? Vascular dementia is most common in people aged over 65, and the risk increases as people grow older. However, it can also occur in younger people and is the second most common form of young onset dementia, where symptoms develop before the age of 65. Those with the family history of vascular dementia may also be at slightly greater risk. Vascular dementia is slightly more common in men, and people from South Asian and African Caribbean backgrounds are at increased risks. Other factors that increase the chance of developing vascular dementia are high blood pressure, smoking, obesity, depression, physical inactivity, social isolation, hearing impairment, alcohol consumption, traumatic brain injury, even high air pollution, and second-hand tobacco smoke. So what can we do to reduce the risk of vascular dementia? In order to reduce the risk or delay its onset and progression, we need to address some risk factors. The risk factor on top of the list is hypertension. So the first action you can take is to keep an eye on your blood pressure and take steps to keep it in the normal range. The second one is smoking. Stop smoking as soon as possible and get help if you need it. The third risk is being overweight. Try to maintain a healthy weight and follow the BMI guidelines. It should be less than 25. Being socially isolated is another risk factor, so being socially active can help with that. Alcohol consumption is another risk. If you are taking alcohol, you should stop it immediately. To avoid traumatic brain injury, avoid activities that can cause a brain injury. Being physically active will have a very good impact on your mental and physical health. 30 minutes of physical activity every day will help with some of the risk factors mentioned before. Finally, if you have issues with your sight or hearing, get these checked. After discussing symptoms and risks, let's move on to its diagnosis. If someone is showing signs of dementia, it is important to get an accurate diagnosis so that correct support and advice is given. However, vascular dementia may be mistaken for other conditions such as depression, stress, relationship problems, menopause, and work-related issues. This can cause a delay in diagnosis. Before the person sees their GP, it is helpful to make a list of their concerns with the list of symptoms and any family history. If the GP suspects dementia, after conducting a brief cognitive assessment, the person should be referred to a memory clinic for a full assessment, including a brain scan. After discussing the risk factors, now look at the treatment of vascular dementia. Currently, there are no specific treatments for vascular dementia, but it is important to treat underlying conditions such as high blood pressure, high cholesterol, heart problems, or diabetes. Medications for Alzheimer's disease are not effective for vascular dementia unless the person has been diagnosed with mixed dementia. That is a combination of vascular dementia and Alzheimer's disease. To slow down vascular dementia's progression, support is required to help the person to stop smoking, regular exercise, healthy eating habits, and in the maintenance of a healthy weight. These steps won't cure vascular dementia, but they may slow down its progression. Finally, some practical tips to manage vascular dementia. Break complex tasks down into smaller steps that are easier to follow. Use reminders like pill boxes or automatic medication dispensers to ensure the person takes any medications as prescribed. It is a good idea for the person to carry an ID card with details of their diagnosis in case they need support in public. Join support groups to share experiences and tips for living with dementia. Vascular dementia sufferers struggle to cope with the change, so be aware of triggers such as noisy or crowded places, being too hot or cold, pain, misunderstanding, and changes in routine. It is a good idea to keep a routine to minimize confusion. Encourage them to keep up with activities they enjoy. Things like exercise or a walk, taking care of a pet, any hobbies like drawing or photography, etc. In rare cases, if CADASIL is suspected, the GP should refer the patient to genetics services. CADASIL is an inherited form of cerebrovascular disease that occurs when the thickening of blood vessel walls blocks the flow of blood to the brain. If you are interested to know what CADASIL stands for, it is cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. If you found today's topic useful, please like, share, and subscribe. Thanks for watching.